Any other legislators?
Yeah, okay. Yeah, House.
Introduce this. Is that all? That's all? It's not to you.
No, it is.
Okay. Hey.
Mhm.
Am I on?
Yeah. Okay, good.
Okay. Hello, everyone, and Happy New Year. Do I see a co-chair, Rep Hashimoto here? We have a number of new representatives. I want to introduce Senator Rhodes that I see on. I saw him on for a minute. Hi, aloha. And I'm going to see if I can introduce some of the new representatives. Representative Andrew Garrett, Darius Kila. Hi, aloha. Representative Kila. Representative Amato. Let's see, who else is on here? Representative Takenouchi. Hi, Jenna. Am I missing anybody else? Thank you so much for joining the Kupuna Caucus this morning or this afternoon. I guess that is all I can see. If anybody else is on, please show yourself and represent tell us you're here. Otherwise, everybody, Happy New Year. Really glad to see you after the break. Today, we are going to focus on the priorities for the caucus. For those of you who were involved, we had 167 participants in the voting for the priorities for this caucus. As you know, we have a number of proposals, but the limitation in the House to 5 proposals, we have voted to see what rises to the top. Not that we won't support the others, but let me go through them. If anybody has any other questions before we go forward, I will put up on the screen the votes on these proposals. There you go. So our care, our choice. I see Sam is on. And creating a rent supplement program for at-risk seniors, 80, those were the top vote getters. Also, a clinical center of excellence to address quality long-term care, caregiving shortages, and that's workforce development for long-term care. And it's, oh, Donald, you have your hand up for.
Yeah, thank you, Senator. Anything that anybody wants to propose on visual, if they can describe it for myself, for those who are blind.
Okay, so so these were described when the votes went up.
Okay.
Yeah, and so they have been described previously when people got the voting sheet. Yeah. And so what I'm reading off now are just the titles for the bills.
Okay, thank you. But if there anybody share screens or anything, if they
I-
can describe.
Okay, so I'm sharing the screen now and I'm
Uh.
reading the proposal and I can read you the votes if you want that. But these are the top 5 votes, but I will read the votes. So the
That'll be fine.
Hawaii, Our Care, Our Choice is 87 votes. Creating a rent supplement program for at-risk seniors, 80 votes. Creating a clinical center of excellence to address quality long-term care, giving shortages. And this is workforce shortages that we've talked about in long-term care. So 54 votes. Enhancing the state health insurance assistance program, that's SHIP. This is the one where they help people learn about the Medicare options, and they do it, neutrally so that people can see what the options are. 52 votes. And create a long-term care education and training entity at the community colleges. And I think this is the one where Dr. Hayashida had mentioned that had been funded in the past, and we're trying to revive that. 49 votes. Those are the top 5 votes. Oh, Debbie, you have your hand up.
Hi, Senator, and hi, Senator, and Happy New Year to everybody.
Here.
Actually, the creating a center of excellence and the long-term education and training entity, we met yesterday and we could actually combine the two.
Okay, so for the long-term
4
education
and 6,
entity?
yeah.
Okay, great. So then it goes down to the next one, which we can add on, allow the receipt of tax benefits without filing tax forms if no taxes are owed. That would be the next one down. That would be number 5 then. And then really closely behind it is the expedient and robust reporting on care home inspections, which has come up over and over again. So if you see anything else, you can combine. We could add that in. But for now, then we will combine. We combine the Clinical Center of Excellence for Long-Term Care, Workforce Development, and the Long-Term Care Education and Training Entity as one. And so the 5th priority would be allowing the receipt of tax benefits without filing tax forms if you have no taxes to be owed, which makes sense. It's more efficient, I guess. So those are the top 5 priorities that the caucus will go forward with it. Does anybody have any questions on any of these? So these will be sent forward as the caucus package. Oh, that's a short meeting then. That's it. The other you can see on the screen, and for Donald, I'll just read it really quickly. The other ones that are not being taken as part of the caucus, but people might be interested in supporting separately from your organizations. That also rose to like 44 votes, is require more expedient and robust reporting on care home inspections. The next is making permanent the nursing facility sustainability program, followed by updating the guardianship laws to conform with the uniform guardianship guidelines. And we had a presentation from the Disability Commission on a council on that. Funding the Alzheimer's disease public health campaign, funding the Healthy Aging Partnership, followed by funding and staffing the statewide mobility management, followed by requiring a periodic reimbursement evaluation for MedQuest. You know, MedQuest is doing the fee reimbursement study for the first time in, I don't know, 20 years, is it, or some long amount of time. And, maybe we should see that done more regularly. I think that's what the bill represents. And finally, enhancing the Senior Medicare Patrol Program. So those are all of the bills that came forward. If anybody wants to discuss any of the others than the top 5, you may do so at this time. Any questions? Any comments? Donald. You have to unmute yourself, Donald.
Yeah, thank you, Senator. I was in favor of the mobility task bill for the outside islands, not for the counties. So what is your recommendation to get this bill proceed on by ourselves?
You could still have it introduced.
Mhm.
And it's a matter of, whether it gets heard, and again, it would be dependent on getting support from some of the other members. You might want to discuss it right now, what it is, and see if you have any comments from others. If there is support, we can proceed. We could introduce it on your behalf, but again, you'll have to do a lot of, talking to the members. But you could tell us right now, since we have quite a few of the members online here. You can, yeah, we could just have people understand what that bill is.
Well, I just want to let everybody know that in 2014, I did participate with the Executive Office of Aging at the time. I was a person in the task force, and I participated with some others like Cindy Evans, Representative Suzanne Chan Oakland, as well as other people from the county and the state regarding this mobility, because we have the baby boomers that are going to be retiring and can't drive anymore, the elderly Kupuna, then the disabled.
So tell us the essence of the bill that you want to see passed.
The essence of the bill was to have somebody in charge to work with the counties on their mass plan for transportation for needs for persons with disabilities and elderly, and to because we have to prepare for our Kupuna and elderly, especially on the neighbor islands. So my famous quote I always say at the legislature when I testified last year was, by failing to prepare, you're preparing to fail, by Benjamin Franklin. So I would like to prepare to have something done. But if the 5 bills that you propose with the group was raised and voted on, I truly support that. But maybe next year, I'm not too sure. Yeah.
So Donald, the caucus is limited because the House is limited to 5 bills, but the Senate is not limited. So if you have a bill and you have drafted from before, we can always introduce it, and you can rally support for it. That would be fine. Then you could have a hearing, and you might want to work with the Disability Council. So that they I'm sure would support it in a broader view, not only for Kupuna, but all disabled, having a mobility plan updated so that they can follow through to help.
I do have the old bill from 2015, 2016 from the Senate side, so that can be used as a platform.
Okay, and then maybe talking with the Disabilities Council people and see what they can do to support that, and look at whether it needs to be updated.
Okay. All right.
Okay.
Thank you.
Sure. Yeah. And Representative Amato, yes. Hi. Aloha. Oh, unmute yourself. Okay. No, still unmute. Okay. Very good.
There we go.
Aloha. Yeah.
Wonky keyboard. Sorry about that. Anyway, Happy New Year. I just wanted to say, Donald, I'm interested in seeing your bill. I'm a disabled legislator, so I have great interest in this. Please shoot me an email. I want to take a look and see what I can do to help. Thank you so much. That's all I have to say.
Okay, great. See, already, Donald, you've got a partner there. So, okay, very good. Thank you. Anyone else?
Let's get the top 5. They want to report the status of what you know.
Since there are no other comments, I want to go back to the people who proposed the top 5 bills and see if there's any status on it, where it is, and what we need to do going forward. So our choice, I think I saw Sam. Sarah? or Audrey?
Aubrey, yeah, hi. And Sarah is here too. We're so thrilled. Thank you very much for the great vote news. I will update you. We have also been speaking with Rep. Bellotti, who is chair of the House Health and Homeless Committee, and also Senator Jarrett Keohokalole. They're both very supportive. And Senator was really pleased to hear that Kupuna Caucus was also working on this. He had mentioned he wants to introduce it, but then went, oh, Kupuna Caucus, that's great. Same thing with Rep. Bellotti. I think that, you know.
Did you talk to Senator San Buenaventura? She is not new. She's the new chair of the Human Services and Health Committee.
Yes, I have. We're on the same island, so I just have to drive down the road and see her. And we've been talking. Yes.
Okay, good.
Thank you.
Anything else you want to report, you or Sarah?
No, I think, well, I did just send to you and to Rep. Hashimoto just a revised wording on the summary of the bill, which we think might help people understand a little bit more about what APRNs are really, what we're really asking for them to be able to do. The bill draft itself you have, and I'm curious, but we don't have to discuss it now, you know, kind of what next steps are. But we are very thrilled. Thank you so much.
Thank you. Thank you. Any questions of Aubrey? Fritz, do you have your hand up? If you do, unmute yourself. Or is that just your logo? Oh, okay. All right. So I'm going to move on then. The rent supplement program for at-risk seniors, is that? This is one that we have introduced. We are working with Rep. Hashimoto on this. This has been a problem, you know, over the years, and so we always try to put funding in for the seniors who are the most vulnerable for being able to afford rent, and we don't want them to be part of the homeless rank. So we are trying to push again, getting funding for seniors who need help with their rent, so they're not on the streets. Any questions on that? We keep putting it in every year. The Clinical Center of Excellence for Quality Long-Term Care, Workforce Development, and the Long-Term Care Education and Training Entity. Do we have, Debbie, you want to talk about that, or Caroline, or?
Caroline's on YouTube, but we have Kendi Ho.
Okay.
Kendi is on the Workforce Development Task Force, I think.
Okay, Kendi, where are you?
Hi there. I raised my hand.
Okay.
All right. So I'll just speak briefly about how we're going to combine the two ideas. Because as we're talking, the scope of the center is unclear, and we want to make sure we get the most salient ideas, you know, into this bill. What our ask is for funding to support development of a new center for aging, innovation, training, and advocacy excellence, and then to pilot some workshops or presentations to see how that planning is going. So kind of the outputs would help us to revise that planning. So we're thinking of a 2-year kind of development for that.
And who is the administering agency? Is it the community colleges, or is it EOA, or where is it going to be housed?
That's the big question we have to figure out. Yeah. It might be Center on Aging, and I think Christy Nishida is on, but we talked about either the Center on Aging or Executive Office on Aging. I haven't talked to Caroline about it, but we do have funds for workforce development, and So this would be like a planning grant because Senator, you're part of the State Council on Legislature's task force or working group on workforce development. EOA has some workforce development funds that we're trying to figure out what to do. And then
And when you say you have funds, it's ARPA funds.
yes,
It's federal funds.
yes, it's
And it's limited to how long? 2024?
I think so. Right. I'm not
Okay.
sure, Caroline, if I'm speaking out of turn, but we do have some time to spend that money. So, and we're a little bit flexible with that, so we can use that, but that money is going to run out. And so we would need we want to develop a plan first, and then use the federal funds as much as it will
Use
take
all of
us.
it, yeah.
Yeah, and then come in for state funding.
So yeah, it would be good if you use the federal funds for the planning part of it.
Yeah,
But then
yeah.
you have something that you're piloting so that you can start getting some state funds so that as a follow-on to that. You know,
Okay,
that there's a continuation of what you do with the federal funds. But it's clear that that
Right.
we don't have to pay anything, but the initiative is in law. So
so
that
we have till September 2024 to spend the federal funds.
okay, okay. Okay, well, carry on. Sounds good. We do need it. We do need the workforce development, especially in long-term care. So I hope
Yes.
that the focus is where the big need is.
Yes, yes,
It
definitely.
goes hand in glove with where I think that with both PABIA and I think Kupuna Caucus focusing in, or ARP focusing in on long-term care, because that's the big need. We've really kind of neglected it these years. Oh, Representative Hashimoto is on. Okay, so anything else you want to report, Kendi, on where you are, where you're going? On this?
Yeah, just wanted to mention that our priority is on direct long-term care workers, but the scope also includes, in-home care, as well as clinical care, institutional care, and then also ancillary services, so food services, et cetera. And then just to address the chat from Charlene, we do intend to have neighbor islands included
Oh,
in
good.
that, as well as something that's culturally responsive and sustaining. So, but still in that development phase.
Yeah, and I guess there should be something planning. I'm just kind of inserting here, but is that we don't have enough community-based programs, and what we do have, and yet it looks like the focus of the feds are going to offloading the institutional care because it's so expensive and sometimes inappropriate, but there's nothing out in the community. So somehow, how do you develop that, both people who are providing the service as well as managing the service, so that we really can have a good community-based program for long-term care needs. So I think that's something else you might want to add to your list. But it's great. We need that. Representative Hashimoto, you want to add anything? We're going through the top 5 priorities bills, and we just combined the Clinical Center of Excellence for Care, the workforce development, and also the long-term care education and training program, I guess it was, in the community college before.
Great. No, I was looking at what we could combine. So that was one I thought. So that's great.
Yeah. And the SHIP program, EOA, you want to say anything about the SHIP program, or anybody here from SHIP? Lauren Lau is Larry. Lauren? I see a hand, but is that the hand?
That's your cursor.
Oh, that's my cursor. Oh, okay. So is anyone here from SHIP? Okay, so SHIP is, that Medicare outreach and education program, which is very good. It's neutral and helps people understand their different programs and make wise decisions without having people in the commercial sector tell them what to buy. Basically. So the one that we added, Rep. Hashimoto, is allowing the receipt of tax benefits without filing tax forms when you don't own any taxes, which makes a lot of sense.
So Rep. Lisa Martin's proposal.
Oh, it's Representative Martin's proposal. I don't know if she's on. I don't see her. So that's all we have on our agenda for today. If anybody has any other concerns, issues, interests they would like to bring up at this point before.
For next meetings.
Oh, wait, Keone from Rep. Takayama's office. Hi, aloha, good morning.
Hi, good morning. I just because I don't know if some people are writing in the chat, so I don't know if everybody can
Oh,
see the questions that are being asked in the chat, the meeting chat.
Oh, yeah, there are. Thank you.
You're welcome.
So guardianship is important and sorely needs an update. Wondering if our choice is larger than the Kupuna Caucus. Oh, there's two different comments. So yes, guardianship is important and sorely needed an update. And I do believe I saw Brian Mick on Brian. It's going to be introduced. So whether the caucus takes it forward as part of our package, it still is important. And I do believe there is a bill that will be introduced that is the uniform guardianship bill. Brian, are you there? Or anyone?
So I think Senator Moriwaki has an unlimited bill count, so she can definitely introduce it on the Senate side, and we will find one on the House side. I've been already. So for those of you who didn't get your weren't in the top 5, please, we'll talk. Like I think we'll figure out ways to get this introduced in a strategic manner. Because I think we had some really good ones this year. I think a lot of them were solid, and I think it was very interesting and very tough, I think, for people to select bills. And so I think we are willing to work on this. And so maybe email us or we'll be in touch, but we'll find ways to get it introduced.
Yeah, I know that the guardianship bill, the uniform guardianship bill
That's
will
an
be
important one.
introduced. Yeah.
We will introduce that.
Yeah.
Senator, Candace Nakamoto is from the SHIP program. She can talk about the SHIP now.
Okay, Candace, where are you? Candace, hi.
I'm
Good
here.
morning.
Hi. So a little bit about the SHIP bill. It's really seeking additional positions to support the program. Our Medicare population has drastically increased, and we can see it doubling as baby boomers age into Medicare. And so to keep up with the amount of deliverables, we need more staff to help support the program.
How many staff do you have now, and how many are you asking for?
We have 2, myself and Wanda, and then we're asking for 3 additional full-time positions.
And you, how do you operate remotely for Neighbor Islands, or do you have somebody on the Neighbor Island?
Yeah, we have volunteers statewide, but our office is on Oahu, and we partner with the AAAs to help as a hub for our volunteers to go to a physical location. And
the 3 FTE you're asking for, are they Neighbor Island based, or they're going to all be on Oahu and work through the AAAs, or how are you assigning?
Ideally, it would be Oahu based.
And serving the Neighbor Islands via volunteers, or training volunteers by these additional people?
Yeah, they would support us in training and managing the volunteers.
Any questions of Candace on SHIP?
I have a question. Why can't it be one person serving Neighbor Islands?
Initially, we wanted the support on Oahu because they're just going to be supplementing the work that Wanda and I do. But there could be discussions on having staff on the neighbor islands as well. But I think our intention was Oahu.
So it's Oahu based, Oahu focused.
My
Okay.
understanding, but that could change.
Yeah, it seems the needs are great on the neighbor islands, and you probably could do better getting support from the legislature who represent the whole state if you could look at how you might serve the neighbor islands.
Okay, that's something that we'll discuss. Thank you.
Thank you.
Okay, any other questions? I'm going to go through. Candy and Debbie request that the plan development include neighbor islands. That's for the Center of Excellence. Yeah. What is SMP? Ship and SMP. Oh, the patrol. Can you combine, Candice? The what is that called? The Medicare Patrol.
The Senior Medicare Patrol,
Yeah.
that's a sister program to SHIP.
Yeah, can you combine the two? Is that real different than what you do?
It's different. Yeah,
How
different
is it different?
program.
How is it different?
Senior Medicare Patrol basically helps prevent, detect, and report Medicare fraud and scams. And so they're more dealing with the fraud and scams, and we're dealing with the general Medicare education.
Is anybody from the patrol on?
Is either Jeff or Norma on? I don't think so.
But you're all under EOA, yeah?
We are. 2 separate grants, though.
So Debbie.
Yeah.
Can you see how what is the patrol asking for?
They're asking for positions also.
How many?
I think two.
And they're different programs with different focus.
Yeah.
So they can't be combined, right?
I think it'd be hard to combine.
Because it's all federally based funds.
Right now it's federally, yeah.
So the number of positions and getting positions, if we got the positions, is that federal monies that will support it, or are you asking for state money?
We're asking
State
for
money.
state money.
Okay. So, but the 2 positions that are now in Medicare and the 2 positions that are now in SHIP are federally funded, or they're state funded?
The SHIP positions are federally funded.
And I
And-
believe SMP is federally funded
Yes,
too.
SMP too. So we're
So
not
if-
permanent civil service.
So if we got you more positions with or more money, is there an increase of the federal funds? Like you increase the match, you can get more money from the.
The funds, it's a 5-year grant. So the funds will change depending on the need. And so our funds fluctuate, but this will not affect the federal funds that we receive.
And when is the grant over? If it's 5 years from when? So
We
what
have-
is the termination date?
We have a few more years left of the SHIP grant. And I think the SMP one, they're just renewing it now.
Oh, so it can be renewal.
Yes, we just reapply for the grant.
Okay. Okay, so the answer to that question of combining SHIP and SMP is no.
No, yeah.
Okay, the Deaf and Blind Task Force, changing the subject, Deaf and Blind Task Force plans to introduce the hearing aid bill for your information. And we'll see where it goes with that. It probably will need another sunrise analysis. But this is the beginning of the biennium. Rick, do you want to say anything?
No, just that I was invited to attend the Deaf Blind Task Force. Senator Joy Ventura is the new chair for that. So she plans to, my understanding, and Donald, you're there, you can chime in, to reintroduce it. I did try to kind of share some of our thoughts around that. So I'm not sure how it'll be introduced. It sounds like they're going to reintroduce the very same bill the way it was written. But
Oh, well, you really
but-
should talk to.
no, I tried. Donald is part of that
Donald,
task force, so I'll
need
let
to-
him chime in.
Yeah.
I was invited as a guest and I
Oh,
was
okay.
barely able to even speak about anything because I'm just a guest. I'm not part of,
Okay.
that's what I was told.
Donald,
Thank you.
Donald,
Yes.
you were in on the whole discussion from Kupuna Caucus with the auditor, and it's really important for him to get the right information. And if we're only paying for devices, it doesn't help anybody. So if you're on that task force, the deaf and blind task force, then you really need to bring up that concern, because then it's redoing what we know didn't work. So I don't know where you are with it, but I see Fritz on too. But Donald, do you want to say something, and then Fritz?
Okay, Senator, I was on the deaf-blind task force with Peter and the other gentleman. I totally agree that, as I had a hearing problem one time, I went to an audiologist and they test my ears. So it's also good to get tested so you can get the right fitting for the audio device, so you don't get more damage. So I agree that's a big factor right there, and not just buying anything over the counter. But before I go any, I had a question for that SHIP or whatever grant, federal grant.
Yep.
How much money did they get for that grant for this for the employees that they have right now? Do they know how much money was from the feds?
Yeah, Candace, you want to answer that?
Yeah, let me check really quick. I have the tracking chart, so I'll chat the amount just in a little bit.
Okay. So we'll go to Peter.
Okay, can you hear me?
Yes.
Okay. The bill that was introduced in 2013 would raise the benefit for hearing aids to $1,500 each. HMSA is $600 for both. So there is a substantial economic benefit that would enable people to get hearing aids. As far as the history of the bill,
We lost you, Peter.
We lost you, Peter. Try again. Okay, well, Peter, are you able to reconnect, close down and reconnect? In the meantime, 2023 SHIP funding was $335,194, and that's to pay for 2 positions and what, Candace?
To run the entire program,
Okay.
to fund our whole initiatives.
And that's for how many years, or is that for per
That's
year?
just for 2023. Yeah.
Okay. 2020.
Thank you.
Then you have Jeffrey here from SMP, Senator.
Okay, Jeffrey.
Senator.
SMP. Yes. Tell us
think-
about your program.
For SMP.
Uh-huh.
So we're the sister program for with SHIP, but we work with the Medicare fraud program. We are a branch of the national program, but we also in Hawaii go above and beyond. Our staff doesn't just look for Medicare fraud, which is what the grant is actually meant for. We also do any kind of fraud that comes through. So I spend grateful amounts of hours on the phone with our callers regarding all kinds of scams. It's quite depressing, but it's also very rewarding to listen to all of the programs. But we have similar funding as Candace does. But not only do they have to fund our 2 positions, but they also have to fund all the advertising expense, all of our the fees that we pay to go to all the booths. Sometimes we are able to get free outreach booths and in the community, but lots of times we have to pay our equipment. We have to pay a certain amount of money for our rent and all of our expenses. So that smaller dollar amount, it's not a small dollar amount, but it has to go a very, very long way. So
Do you folks have attorneys that actually go after these guys, or is just information and referral?
So that's one of the great things about both of our programs are that we don't actually have to pay for the legal fees and all those expenses. We really network with our other community resources. So our dollar amounts that are spent on our salaries and our overhead really translates into our recruiting and a great amount of volunteers that get brought into our program. Our volunteers, I think Candace will agree, is the absolute heart and soul of our programs. Without them, we couldn't do anything. And so the actual legwork and all of the work that's done with the Kupuna in our communities is mostly done by our volunteers. So though we have 4 staff right now that get paid our salaries, we have hundreds of people that are working in our communities. So those 4 positions really, it just magnifies with the amount of people. And, you know, if we could get the additional support in our offices from our staff, I mean, we're not just talking about, you know, having 4 more staff. We're talking about the ability to then get more and more and more volunteers, which just magnifies even greater. And, you know, there's a great resource for our volunteers as well as the social capital they build working in our program. So it just magnifies in both directions. And then the reach that we are able to get with just 1 staff is just magnifies, you know, so. If I'm very passionate about this, it's because I very much love our programs.
So you have 4 people now, you have 4 staff, including yourself.
Between our 2 programs. Candace also should mention too that she also is the director for another program as well. So she wears 2 hats. So she's very busy in her.
Okay, so you have 2 just for.
So yeah, Jeff, the SMP just has 2, Jeff and Norma. So Jeff's the volunteer coordinator, Norma's the director. And then for SHIP, we just have 2.
Oh, I see.
And then I run a separate program as well.
And so Jeff, you're asking for 2 more positions.
We are.
And
for SMP.
What is your current budget?
I actually. Oh, sorry, Senator, we are actually asking for 3 positions for each one of the position or each one. And I don't actually have our budget dollars. I can get that to you. I don't know how fast I can get to it, but it's somewhere similar around to Candace's budget. I'm going to.
And you have the similar time frame, the 5-year program?
We do.
They're around 5 years. Yeah. Same federal funder, ACL.
So do you have at your fingertips, you and Candace, how much it's costing for the 3 additional positions?
No.
What are you asking?
It's going to be somewhere, it's not going to be as much because a part of the $300,000 that, like for Candace's budget, for example, part of that is the expense for our office space that we have to pay a certain percentage back to the state for. It's copy machines, it's, you know, all of the thing. So the dollar amounts for the salaries, we can get those to you as quickly as possible. We'd have to work with BNF, but I think we can get those pretty rapidly so that you guys can have a really good idea of what it's going to cost.
Okay, anybody have any questions while we have Jeffrey and Candace on? 2 good programs, understaffed, but lots of love and volunteers. But anybody have any questions?
Well, I would toss out, this is Rick Tabor again.
Yeah.
So on January 19th, Thursday, Wanda's going to present the SMP or the SHIP program to HPGS, Hawaii Pacific Geological Society. You're all invited. I will send the flyer. So I send it to Charles, Senator.
Yes.
To get out to everybody. So I'll send that out to get it to everybody. So that's coming up pretty quick.
I think
what time? What time?
Oh, I'm sorry. So 11:30 till 12:30. And we also have, along with her, then we also have somebody from Social Security. I don't have her name handy. That's going to present about Social Security also. So a pretty good presentation. I'll get that flyer to you all. Thanks.
Yeah, we will forward it to everyone.
SHIP will also be presenting to Pavia on February 3rd as well.
Okay.
And I believe Debbie just chatted the amounts we're asking for.
Oh, okay. So everybody, you can look at the chat.
229,000.
229,000 for SHIP. And
Senator, this is Barbara Service.
Yes, Barbara,
Can you put up the list again? I didn't get a chance to take a picture of it.
Okay.
The thing
Charles,
I sent you a picture, Barbara.
Oh, thank you, Rick. Okay. Thank you.
So 229,000 for 3 additional positions for SHIP and the same amount
For SMP.
for SMP.
Mhm.
Okay. All right. Any other questions, comments, concerns?
Senator
Yes, who?
Donald here.
Oh, Donald,
So-
yes, Donald.
Yeah, I think Peter Fritz has come back. I'm not too
Oh,
sure if he's
okay.
back yet.
Peter, are you back?
I'm back. I just
Okay.
lost my
Okay.
connection.
Okay.
Point is that the bill that's being proposed by the Deaf and Blind Task Force is similar to what was proposed earlier. It will raise the reimbursement for hearing aids to $1,500 per hearing aid. And that would be an increase from the $600 for 2 hearing aids of HMSA. Furthermore, it reduces the replacement period for hearing aids from 60 months to 36 months. And 36 months, from my experience as somebody who has a severe hearing aid, hearing loss, is about the time that I might need to repair it. If you can't get people to afford hearing aids, the adjustments don't matter. And based upon the issues that have been presented in past years, this is a starting point. If you ask for too much, you're going to find that it's not going to be there. But there's definitely an economic benefit contrary to what Les said, because increasing it to 1,500 and lowering the replacement period to 36 months is there. Furthermore, many of your medical professions, when you go in to medical insurance policies, you go in to have your hearing tested, and then the audiologist that works for the physician is paid for by my insurance policy. Adjustments and what I purchased that particular way.
I don't have one here.
I'm sorry.
What was that? Is okay, continue, Peter.
So all I'm saying is there is an economic benefit, contrary, just by increasing the amount that you can get paid and lowering the replacement period. That's very important to people. And if you follow the testimony that's been introduced over the years, you will find many parents are saying, we need a lower replacement period and we'd like to get more reimbursements because our kids are hard on it. And anything you can do to improve it would do that. As far as the issues, I sent Charles an article about over-the-counter and other hearing aid replacement comparing the cost. But if the average cost, according to this article, is $4,600 for a hearing aids, then anything you can do to make it better is going to be an improvement. And that was the point of the DBTF.
Okay, so the adjustments and the assessment you're saying comes anyway. So if you're going to buy, at least you have a starting point on the cost of the device itself and the replacement of the device. Is that kind of the focus of the Deaf and Blind Task Force?
The Deaf and Blind Task Force is looking to make hearing aids more accessible, period. Including the other things such as batteries and adjustments. In certain cases, when you buy hearing aids, you get adjusted when it's there. The presentation that was made to the Deaf Blind Task Force talked about Medicaid. And the Medicaid is a replacement period every 24 months. And I think they also include an adjustment or two in their particular policy. Open the door. That's the whole point. Let's get the door open. Then we can talk about other things. Also, the DBTF is setting forth a bill to change the GET law to exempt hearing aids from Hawaii's general excise tax. I paid $2,700 for a pair of hearing aids and I paid about $150 in tax. And that also the language that I drafted would also include an exemption for repairs, and it might include battery, but you'd have to do that with the Department of Taxation. And if you don't have any other questions, I'll be happy to answer questions, but I'd like to circle back to the one about not filing taxes
Okay,
and getting a
hold on.
refund.
Let me, before you leave hearing aids, Rick, Tabor, do you have any comments on that, or the focus being, just let's get our foot in the door?
No, I just think it's good to just continue with the hearing aid piece and reintroducing it. It'll be interesting to see how it's actually written when it actually comes out. I'm not on the task force, so I can't really influence that like I hear with Kupuna Caucus and Pabia. But it's good, like Peter said, let's continue it. Maybe get the review, and then we can tweak it as it goes along. I guess so, Peter. What I'd said or I hope I was able to get this point across. We really need to have local data to push this through, because really what I've run into is mostly national data. So really, what here on the island specific to hearing loss, since we're passing this at this level, and then go from there. I mean, there's a whole ton of stuff that I've stumbled into. I know that Dr. Balaz is going to help me out, and Kaylee Lopez. I've got several people. Even Judy Moore Peterson she's got some data, so we can kind of team and pull this all together going forward. But we don't have a lot of time to gather all this information, so I guess I would just really support just getting the bill reintroduced, and then we can. I'll certainly work with it as we go along, and we'll go from there. Thank you.
All right, thank you. Okay, so Peter, you wanted to circle back to the exemption for tax.
Yeah, but first I'd like to add
Tax
something.
reporting.
If you look at my testimony from past years, you will find that I refer to certain studies by places like Johns Hopkins that talk about how improving hearing aids and correcting hearing loss actually resulted in a decrease in the amount of medical expenses that a person has. And there also is a certain amount of data that I cited regarding, I didn't want to use the term dementia, but just in terms of mental awareness and stimulation that comes from people having their hearing aid corrected, and 85% of the people that have hearing losses don't have it corrected. All of that's in my testimony on bills and prior years.
Maybe, Senator, we should take this conversation offline, because this is going to happen anyway through another mechanism. So I don't think we should take time out of Kupuna Caucus right now.
Okay, good point. Anyone else with other issues? Okay, I see nothing. So I just want to move on to any announcements. Anyone have any announcements? We already know about the hearing aid. The SHIP presentation, both to Pabia and to HPJS. Anything else? Okay, seeing none. Again, we open the floor to future Kupuna Caucus topics that we can consider. So if you have any, please email it to us, or you can bring it up here. Donald, yes?
Yes, Senator, thank you for doing this Zoom and whatnot for us, but I look forward to eventually have an in-person meeting with everybody so we can see each other in person and collaborate and have fellowship.
We will.
Thank you anyway.
That. That's a good point. We would like to do that too. I think the Senate is going, and I'm sure the House is as well, going to hybrid when the session begins. So there'll be opportunities for people to meet, as well as especially neighbor islands it allows for neighbor islands to Zoom in and be part of our meeting. So I think it's going to be hybrid time for us. Oh, hi, Kathy. Happy New Year. You have your hand up. Hi.
And happy 12th night of Christmas too, by the way. I just want to say that I think it's really important that everybody understands the Alzheimer's, the public awareness campaign that Alzheimer's is doing now. That was on that list that went down to the lower end of the list. But it would be nice to be able to have a discussion with Ron Shimobuku, I think is his name, his last name. I can't have a hard time pronouncing his last name, but people aren't aware of what prevention can do, what early recognition can do. the new drugs coming up that are showing really great signs of working to prolong the regression or the progression of the disease. So I think that'd be a great topic to hear about, because I'm sure everybody here does not understand what this the campaign means. So just my thoughts.
All right, we will look at a session on that. I know that Judy Moore Peterson has some of the rate reimbursement, the study results. So I think Rep Hashimoto and I will be meeting with her, but that might be another presentation if there is interest, I would think, on long-term care and some of the reimbursement rates and what the study shows, and might be something worth listening to. Anyone else with any other topics that you think we should be addressing or hearing about? Okay, well, you can think about it and email Charles, and we will definitely follow up. Is there any other business? Seeing none, we will say aloha until next time. I'm adjourning the meeting, and hope to see you next time, maybe in person and hybrid. Aloha and Happy New Year.
Thank you. Thank you.
you.
Thank you.
Aloha. Thank you.
Aloha.
Bye.